I have my patients, well, they're ambulatory, right? All these cases are done in an outpatient surgery center. They get in a car, go home that night. Very restful the first day, but I make sure the patients are up and walking around thereafter. I tell them they can walk as much as they want around the house or around the neighborhood, but no exercising until I see them at 2 weeks. I personally see my patients at 2 weeks, look at all their incisions, and if things are healing well, then at 2 weeks, I let them start doing light exercise, which means even some cardio, some low impact cardio like spinning or stair climbing. I let them get in the water. I let them do a little yoga and some light weights, maybe 5 pounds per hand. And then at 4 weeks, they can double that to 10 pounds per hand and they can try to run. Sometimes it takes 4 or 5, maybe sometimes 6 weeks for people to feel comfortable running. It's the bouncing of the running that's uncomfortable. They can do racket sports and team sports after 6 weeks. So it's a graduated increase in activity, but you can be getting a sweat going, get your heart rate up after 2 weeks if everything's healing well. I take my photos at 3 months, but I think the result gets even better and the scars fade even more, of course, after that. If I could get everybody to come back at a year, I would, because that's when the scars really have matured. But it's hard to get them to come back because otherwise they're fine and they don't need to see me. It's just because I want photos. So I'll ask them, come back in a year if you'd like, and we'll get a final set of photos, but not often does that happen. So on the website, and by the way, all of my patient photos, my patients have access to those photos so they can get onto their patient portal and see all of their before and after photos anytime they want. But the website has a big gallery of before and after photos.